medical ethics. Okay. Um, Earlier, this topic used to be the part of curriculum as per the Kathmandu University guideline, and it was included in like introduction to clinical medicine, something like that, from community medicine perspective. So this is again this the word ethics and medical ethics is in a sense, excuse me, part of the medical education. So it has a close lineage with this social science topic. That's why I've seen a couple of MCQ being asked from this type of topics also. So today's discussion will be focusing on medical ethics half of the time, and then another remaining topic, it's about social problems, prevailing social problems. So before going through the details about what is medical ethics and what are the different criteria, etc. So let's go through some baseline information about how the histories has evolved and what are the significant events and activities on the past. Since antiquity, you might have seen that many doctors after graduation they do the Hippocratic Oath, etc. Since antiquity, the doctor and patient relationship has been governed by a system of medical ethics. Actually, it was drawn from the historical opinion like Hippocrates and Chinese and Indian medicine and other traditions, and all held that the patient's good transcended other considerations also in the society. So the physicians determined what was the patient's good. So the modern codes of medical ethics have added a social dimension on it. Okay, so modern medical ethics codes have added a social dimension and a responsibility for health, the good of society, and the humanity in general, and a concern for justice and equality also. So you might have remembered like Health for All campaign and primary health care campaign with its emphasis on social justice, equitable distributions, allocation of resources, use of low affordable technologies, on the responsibility of communities, we call it community participation and individuals for their own benefits and own health. So this is an expression for this change. That means from the ancient time to recent developments, the medical ethics and medical course has been keeps on changing. So it represents an evolution in that sector. So the transformation of medical ethics has been stimulated partly by the progress of medical biotechnology, you can say, and partly by profound social changes. Because everything is changing, social dimension is changing, our society keeps on changing, and that is associated with the recognition of human rights, consumers' rights, and their freedoms and autonomy, and many medical choices can no longer be made purely on the basis of medical science only. So, with this background, let's see what is our course content. And before going that, you might have remembered and is what is written in the Hippocratic Oath and all. But this um, starting code, we call it Hippocratic Oath, itself within this had many changes has been occurred over the period of time. Several parts of the oath has been revised over the years. That means uh, with the pace of time, everything is changing because social values, norms, customs, cultures is changing. Okay, like for example, these are the changes that has been occurred over the period of time. To consider dear to me as my parents, him who taught me this art, to live in common with him, and if necessary, to share my goods with him. Nor I will give a woman a fishery to procure a bosun, and I will not cut up her stone even for patients in whom the disease is manifest. I let this operation to be performed by practitioners, specialists in his art. These are just an examples only, I just included. So we are not going through all the theoretical and philosophical background. We want to know the basics about what is medical ethics and what are the morals and principles related to it. So the first question, what is ethics? So you just correlate with these terminologies for your exam purpose also. Many of the terminologies I've seen, several of them I've asked in MCQs questions also. Ethics or moral philosophy is the systematic endeavor. It's a systematic endeavor to understand moral concepts and justify moral principles and theories. So that means it's a systematic endeavor to understand what is needed and what is accepted and what are the principles on that basic principles, what is needed. Okay, so morality and ethics. So these are the two words which have the ancient lineage. The terms moral and ethics come from Latin and Greek word like other words, other many words, respectively. Like we have discussed about what is mores and norms and ethos, etc. during our terminology classes, and deriving their meaning from idea of custom. Custom mean traditions, like what is handed down from generation to generation. What chalan chalti in Nepali, that is what is happening, that is handed down to new generation. So that means moral and ethics that has been it is a culture of handing down to new generation. So there is also another Greek word, we call it ethos, which denotes a character feature. Character feature. What is your ethos in life, for example? So what are the basic principles for ethical, what are the ethical principles then in a medical practice? Commonly quoted ethical principles are autonomy. Autonomy. Okay, autonomy means you have your a right to practice independently. Beneficence, the art of doing good, justice, non-maleficence, that is, doing no harm to others. These are useful, but by themselves are not adequate for ethical decision making in medical care. So, what is what is right? But what is right is just a matter of social norms, it's just a matter of social norms because it keeps on changing over a period of time. For example, slavery in human evolution during the course of history, you can observe that it was a social norm at some point of time, okay? But it is no more a social norm. The professional norm is not always right. It does devise over a period of time. As I said, it keeps on changing on the basis of social requirements. What is legally permitted is not always right also. So there occur sometimes, conflicting situation, legally permitted things and the rights and responsibilities. So there comes the rights and obligations, etc. The commonly quoted universal human rights, Manavadhikar we say in Nepali, in Hindi, the right to live, right to the life, right to freedom, right to own the property, citizenship rights like voting, nationality, participation in public life, rights to standard of education behavior by the governments, that is the protection of the rule of law. These are the basic rights of any human being. Okay, so while talking about rights, there comes responsibility along with that, and these rights and responsibility in health sector has been put forward and further defined by World Health Organization. So as you know, the World Health Organization, the governing body in the world, is a specialized agency of United Nations, formalized in 1948, and the Universal Declaration of Human Rights recognizes the inherent dignity and the equal and unalienable rights of all members of human family. And it is on the basis of this concept of person and the fundamental dignity and equality of all human rights. What is the basics about this is health as is a basic human right also. It is, it is quoted and recited in Geneva Convention papers, and then World Health Organization's major vision also. There comes another word, medical ethics. So what do you mean by medical ethics? It is based on philosophical ethics that you just discussed. And it isn't an special ethics, but rather ethics of special cases. So where, like in other parts of our life, in medical care practice, it applies certain medical ethics here. Medical ethics does not concern only about doctors, but also patients and society. Okay, so while in talking in general public, people may say like that those ethics, the ethical values and the ethos should be, sorry, so it's a part of medical practitioner only. No, there is a responsibility on part of patients and the society also. They're also bound with those medical ethics. The central question of medical ethics is the doctor-patient relationship. As you discussed yesterday, in doctor-patient relationship, is a basics of good relationship based on communication. The communication should take place on three dimensions. One is emotional, cultural, and intellectual plane. So there, it's not like, doctors only is responsible for maintaining proper rapport and proper relationship with the patient. Patient has also responsibilities. Patient has also showed some concern and ethical, have to follow some ethical principles. So the nature of morality talks about moral acts are acts done to benefit others, that are altruistic and are not motivated by self-interest. So how we define morality is, it has to be altruistic in nature, selfless help, and are not motivated by self-interest. So that is actually moral principles. The morality makes reference to right and wrong and permissible behavior with regard to basic values. So there are, again, you have to consider what are the basic values. On the basis of that, what is right and what is wrong, and you have to decide that. The moral duties of the doctors, we just try to quickly finish it. It's just an added topic here. The duty to help and cure, the duty to promote and protect the patient's health, and the duty to confidentiality, and the duty to protect the patient's life, and the duty to respect the patient's autonomy and privacy, and duty to respect the patient's dignity, self-respect. Okay? And as I said, in doctor-patient relationship, the moral rights of the patients also are there. The right to high quality medical service, the right to autonomous choice on the basis of their own conscience. They have the right to take a decision and choose the medical services available, the right to be informed, the right to privacy, the right to health education, and the right to dignity. So we're just talking about principles and ethics and then basics, values and moral values here. Let's take some examples of some ethical scenario. Suppose if you consider yourself for a while like a medical practitioner sitting in a hospital as a responsible physician, and let's take this example. The medical error has occurred in course of caring a patient, let's say, and should the treating physicians disclose this information to the patient? It's an ethical scenario. A medical error has occurred, some mistakes have occurred, or some occurred, some just error occurred. And should the treating physician disclose this information to the patient? Should you have to inform the patient or detail everything about what has happened, etc.? This is an ethical scenario. When the patient suffers significant medical complications that may have resulted from a physician's error, or a physician is ethically required to inform the patients of all the facts and necessary to ensure understanding of what has occurred. That is actually a patient's right. So what we saw here, a ethical scenario, and then we concern to, like, a lot of social problems or complexity that can arise if you do disclose or do not disclose. And beyond that, if you follow the moral principles and the patient's rights to get information, then you have to inform them what has happened, how it happened, and you have to inform. That is actually the rights of the patient to get the proper information. That's why we say right to privacy and right to self-dignity. Okay. Another scenario, let's say, is it ethically permissible to accept gifts from pharmaceutical representatives? Maybe not a good examples, but we can take this as an ethical scenario. Is it ethically permissible to accept gifts from pharmaceutical? As you know, you can see in hospital many pharmaceutical representatives keeps on coming and visiting the physician to sell their medical product. But for the sake of some benefits, and is it okay? What does the ethics of medical ethics says is any gifts accepted by a physician should primarily entail a benefit to patients and should not be of substantial value. If it is beneficial to the patients, is it okay? It's okay, but should not be of substantial value. The individual gifts of minimal value are permissible as long as they relate to physician's work. If the pharmaceutical representatives comes and sell for their own business purpose, and they wants to promote, probably they are promoting a very good brand new drugs, or maybe we have a very high efficacy, or maybe they wants to sell their drugs for to to increase their market value. So whatever it is, but the doctor has to take a decision on the basis of whether it is beneficial to the patient care or whether it is beneficial to their everyday work, whether it actually enhance their performance, etc. Then only it's okay to accept those benefits or those gifts from those representatives. So this is just a short glimpse of just maybe you find it little different topics for discussion, but it's a part of medical science and so medical sociology, and then I thought it is worthwhile to share it here. And for today's discussion, as I said before, the major point for discussion today is about social problems. Okay, social problems. Sorry, this I don't know what is happening here. This video is not working still. Anyway, doesn't matter. Social problems. Okay, so what do you mean by social problems? It's a part of our curriculum, main topic in sociology. That's why I'm trying to include it here. What do you mean by social problems? The social problems, what is social problem? In a community setting, as a community science people, as community medicine people and public health worker, in a community there are both individual and social problems. Okay, when individual problems affect a large number of people, it becomes a social problems. Okay, so some of the present day social problems you can say are like randomly you can observe, like alcoholism, let's say, drug dependence, sexually transmitted disease, vagrancy, juvenile delinquency, prostitution also they say. And some of the social problems have medical implications also, like for example, the transmission of sexually transmitted diseases, venereal diseases, and social problems that can be solved by social and political actions also, and that is by social welfare programs, which need wide actions, like multi-dimensional actions, social assistance, social legislations in the community to cope those social evils. So there are so many acts and laws has been formulated to curb to diminish those social problems in all parts of the country, in the world. We'll be discussing today here major social problems prevailing in our community, starting with delinquency. Delinquency. Some of you might have heard about this. What is delinquency? Delinquency is like a delinquent is one who knows or who shows deviation from normal behavior in daily life. In other words, he is one who has committed an offense, who has committed an offense. And like, for example, theft or sexual offense or murder or burglary, etc. Delinquency is a big social problem in many communities nowadays, and the cases responsible for delinquency are social, we call it social maladjustment. Is the factor responsible for delinquency are social maladjustment, and then disturbed home condition, we call it problem family and broken family, as you said, poverty, obviously, and drug addiction or maybe abuse and alcoholism, and partly because of modern ways of living also. So, even though there are several around the world in many countries, several child protection acts have been formulated. Since it has, this type of social problems has these causes are varying in degree. So it needs lots of wide spectrum of actions from the different dimensions, like social protection, social rehabilitation, and then strict enforcement on rules and regulation and the existing legislation, etc. Another problem, another problem we listed here is about dowry system, dowry related. Okay, so this is quite an interesting topic for maybe somebody who was brought up and is staying in Western societies, but in our part of the world, dowry system actually, historically, if you see, was started as an innocent custom in our culture, a symbol of love from parents to their daughter, or it was actually gifts given to the marrying daughter on the eve of marriage. But over the period of time, especially in recent years, it has grown into a social evil, we say, with many instances of, like, you can hear in media here and there, in social media, bride burning, acid burning, and suicides, etc. And these are the symptoms of societal corruption. From sociological point of view, we call it societal corruption. Although there are a lot of dowry prohibition, the Prohibition Act has been formulated in India. Long ago it was formulated in Nepal also, in other part of the country, part of the world also. Like it was, the Dowry Prohibition Act was formulated, I think it was in 1986. It was formulated for the first time in India, and recently in Nepal in 2018. But it has difficulty in enforcing, because it has these roots are so widely grown into our culture. What is required here is a sustained effort to go into those root causes for these social evils. So a well entrenched social measures, social customs cannot be easily erased by those social acts and the formulation of social acts, because the acts and laws are in papers only. So our systems, our governments and authority, more importantly, public has to accept that this is a social evil and have to reject it. That is why, because the public health education is so important. Health education program is very important. It's a vital, the number one important factor on avoiding such type of social problems in the community. Another topic, more important topic, we're not discussing through this all this morphology of drug addiction and etc. But here we'll be discussing about what is drug addiction and what are the signs and symptoms and how to manage principally. Drug addiction is defined as a state of, as you know already, a state of periodic and chronic intoxication which is detrimental to individual and society also, which produced by a repeated intake of habit-forming drugs. Okay, it's a state of periodic chronic intoxication, which is detrimental to the individual and society, produced by repeated intake of habit-forming drug. The drug abuse has reached an alarming proportion in recent years, and drug culture is fast making inroads into the lives of young people. Because the young people population, as you know, in all demography, under 15 years, the population is around 40%. So it is a very, very fragile age to get diverted into. As you just talk about juvenile delinquency, they are, during teenage and early part of the age, and people are likely to get derailed from these habit-forming things, and then because of so many cultural factors and societal influences. Okay, so the drug culture is fast making inroads into our daily lives, and especially in youth. So the reason given for drug dependence, as a social science perspective, is why the people do drug abuse is because, like, they're starting with the curiosity, the curiosity and natural tendency to experiment with drugs. First one, and the other is disturbed home environment. We call it like broken family and problem family situation. Children from broken homes mean when parents and father and mother are separated, or either died or they're divorced, etc. And then there is the children who have to be looked after by the parents are not getting proper attention. In such situation, indifferent parents, lack of communication between parents and children, etc. And the other reason is like an escape phenomenon for tensions and frustrations in everyday life, like an unemployment and failure in examination, etc. for the young people. An impact of like new culture, we call it disco culture, the sociologists prefer to say, and social media also, and then ignorance regarding the habit forming nature of drugs. These are the major reasons. And the drug addiction, that to call a drug addict, a particular person a drug addicts, these are the criteria should be met. Like, these are this criteria that must be satisfied in a particular person, like psychological dependence. Psychological dependence. There is an increased overpowering desire. There occurs an increased overpowering desires, or compulsion also we say, to take the drug and obtain it by any means. He or she who is drug addict will just go through this psychological dependence. In any means they try to get that overpowering desire deposits. And another is physical dependence. When the drug is withdrawn, the patient shows withdrawal symptoms, which we call physical dependence. And such an irrational and violent, sometimes they show violent behavior also, and some like, diarrhea, nausea, or watery eyes or noise, these are signs and symptoms we can observe. We call it, these are symptoms of physical dependence. And development of tolerance. So there is a tendency to increase the dose, keeps on increasing. So these are actually the criteria which defines a particular person is whether drug addict or not. Psychological dependence, physical dependence, and development of tolerance. So how to manage it then? Though the drug addiction is considered as a social problem, the first step in its management from a medical point of view includes the identifications, we call it. Identification of drug addicts and their motivation for drug detoxification. Like identification of drug addicts, and then there starts like, the drug addicts also should be motivated in such a way that he should understand that he is a drug addict. That is actually a very, very important step. It is a very pivotal step to start with. Like, it's a lot of effort is required to identify the drug addicts and to make them realize that he or she is a drug addict. Okay? And next is detoxification. It requires proper hospitalization that the physician does, and post-detoxification, like it requires lots of stages of counseling and recounseling and follow-up on the basis of clinical visits and home visits, etc. And the last stage is rehabilitation. So uh, along with this, simultaneously, medical treatment, changes in home environment, like home, peer group environment, like school, college, social circle are important. And why? Because the patient must effect a complete break with the group. Like they should be away from that group where they were usually belonging in earlier times. Otherwise, the chances of relapse is always 100%. So that is important to know. And for the prevention purpose, mainly health education is, here is very, very important. Prevention measures is usually include education of target groups and in general public through mass media, audiovisual media, leaflets, posters to create awareness of the problem. Like sometime your Rotaract people, your seniors, dies and disease are doing. And this is the method, actually, sustainable method we call in public health, sustainable method, and to make people aware. Like in health education, what we say, like what is health education? It's an informing people, motivating people, and guiding them into action, right? So informing, motivating, and guiding them into action is very, very important in case of drug abuse, curbing and then controlling in the society. Another is alcohol abuse. Very big problem, very commonly seen, and lots of consequences also. So alcoholism is an worldwide social problem and also a medical problem also. And if you observe this in some statistics, and if you have a habit of going through and reading the newspaper, and then which contains public health related articles and activities, over the last 30, 40, 50 years, alcohol consumption has increased in quantity and frequency in all societies, in all parts of the world. The age at which people start drinking alcohol has also declined. Okay, the population groups at great risk are those undergoing rapid socioeconomic and cultural changes. They say the middle class society. As discussed in socioeconomic classification, in our context there are five different socioeconomic status. So middle class mean whose incomes are mediocre type. They view alcohol as a symbol of prestige and social status. People regard alcohol consumption as a social prestige and strategy. Look, I can afford this. Look, I belong to a prestigious group or something like that. So this is in perception of a general public in our society. So what can be the consequences? The excessive alcohol results in serious medical and psychological and social problems, and like spectrum from recently there was a horrendous crime occurring in Kathmandu related to some alcohol consumption. Matter every day here and there in social media. So lots of crimes, lots of social crimes and vagrancy and delinquency are associated with alcohol abuse. Alcohol abuse, like crime, murder, prostitution, neglect of families, malnutrition also even, and child delinquency, accidents most frequently seen, binge drinking related accidents. We say in epidemiology, there is a phenomenon we say like weekend syndrome of road traffic accident. Road traffic accident, RTA, related to a weekend syndrome. What does it mean? In Friday evening, majority of cases in hospital emergency are related to road traffic accidents. And that has a correlation, closer correlation with alcohol consumption. That is a major consequences nowadays you can observe here and there. And many consequences you can list out, like alcohol dependent syndrome, alcohol related alcoholic psychosis, unemployment, indebtedness and child delinquency, and loss of friends and self-esteem, and many of the consequences you can list out. The list can go further ahead. So these are the consequences of alcoholism. And then again, coming back to prevention, as I say, identification of risk factors is essential. So as a medical personnel, what actually is causing a person to become an alcoholic, it is very, very important to what actually, according to that, you can make a management plan for the prevention and control and rehabilitation of the particular case. Widespread public health education and discussion and investigation of public attitudes may result in measurable improvement. So drinking by adults serves as a role model. If the adult people are drinking, then the young people can follow that. So they'll regard the adult as a role model. The identification of risk factors is essential for the prevention, obviously, but as drinking patterns vary considerably from place to place, time to time, the prevention of alcoholism is very, very difficult. Widespread education and then effort from different stakeholders and different societal development partners is very, very important. Okay. Another problem, let's discuss in our context, in unmarried mothers, I would say it's not like unmarried mothers, unmarried fathers also you can say. Let me revise that. Even though it was written like this in part book, I have to, I prefer to add unmarried, let's say parents. Sorry for that. Okay. I took reference from part textbook, that's why it was written like unmarried mothers. So accurate statistics is lacking in our context, and because of this, lot of social customs and tradition associated with it. But in Western society, I was recently going through some articles in Family Health Journal in United Kingdom, and the unmarried mothers is a big, big problem on Western and industrialized countries. Such mothers, such parents, you can say, have multiplicity of needs, not only for the medical termination of pregnancy, but for the guidance and emotional support and understanding. So we lack social schools, institutions, and helping agencies for taking care of those type of parents, and especially, in why they're including mothers here is because, unmarried mothers are hardly hit. It's very difficult for them to take care of themselves and the children, and then with associated social taboos, and this is such a big, big problems. And as you say, as you just observe here, the accurate statistics in our society is actually lacking. There is no registration system, and there is no vital statistics associated with how many are unmarried mothers, unlike in Western societies. But it's a big problem, and it's ever-growing problem in our situation. Okay, so for this again, the prevention may be law enforcement and legislation, and again, it's a social problem again, and the root causes of problem is again cultural values and maybe the way we think and behave, etc. And public health education again plays pivotal role here. Last problem to discuss today is social problems is handicapped. So I heard from during last couple of years, the word handicapped has been getting a lot of attention from social science perspective. I heard some of my friends who are working in different agencies. They say like you don't have to call a particular person handicapped. They say like this is differently abled, you know. But recently again, the differently abled vocabulary has changed back into handicapped. So there is maybe, I don't know, this type of jargon word being used by different social development partners, but handicapped is someone who is like, unable to carry out daily routine works. Okay, so it's one of the biggest social burden, maybe one of the biggest top social problem. Because why? I'll tell you why. The very simple fact. In our situation, I just this morning only I saw some statistics and population numbers, handicap numbers in India, because it was not totally counted as such, and the census data is vague in Nepal, even though the government says 1 to 2% of the population in Nepal is handicapped. 1 to 2%. Nepal population is around 30 million, 3 crores. So 1 to 2% mean how many? 2 to 3 lakhs? Or maybe even more? Not one. So this is the 2 to 3, the couple of lakhs, I mean, 500,000 almost population. In India, the Park book itself is saying like 2011 census data, the blind population 5 million, the hearing disability 5 million, orthopedically disabled 5.4 million, multiple disabilities 2 million, etc. I read it from a cheater paper here. So that means around 25 million population there. 25 million. See the population of India, and in Nepal. Likewise, similar figures in Bangladesh in proportion to their population. Like in Bangladesh, population is around more than I think 15 crores or around 15 to 20 crores. I read somewhere, I'm not sure, but still in developing countries, total handicapped population is around, on an average, the ILO and WHO estimates like is around 1 to 2%. This is an ever-growing problem again. So why this problem is ever growing then? You know, and this is because there are so many social factors related to. Like if somebody is mentally handicapped, mentally ill, or speech disability, and our government does not have provision, if these laws and acts are there and the peoples are still not receiving. You can see that these deaf and handicapped people lying in Mahendra pool also, and they are just you know, for their survival, they're singing songs, etc., etc. You can observe here and there. And there's a, left behind people. Nobody is observing. Since the government itself is not looking after properly, so it's a big social burden. And if somebody is handicapped at home, it's a burden to the whole family. You know, he or she who is handicapped has to receive medical care, education, vocational training, job placement, etc., and other facilities in life, which becomes a burden. So this is actually should be a responsibility of the government. So government should take care of the handicapped population in terms of medical care facilities, education, etc. There should be particular vocational training facilities, educational facilities, particularly designed and tailored for a particularly handicapped people. So this is actually a big problem again. So to curb this, as we can take advantage of our own technical know-how or knowledge for if in our community or in a family somebody is handicapped, we can ask for some facilities from the government and put them into vocational training and particularly design educational school, and thereby they become self-reliant and independent in later life. And just keeping in mind, it's a big problem, and in our society, it's an MCQ question. A couple of times I saw 1 to 2% population is handicapped. So I think this should be the today's end of the discussion for today's class. And as you know that the exam is approaching, if you have any particular queries and if you want to revise some topic, please let us know a couple of hours before in the chat group here in Microsoft Team. But tomorrow I'll be letting you practice some more MCQ questions and a small topic related to operational research or some other minor topics of discussion here, and thereby I think we'll be concluding the third semester curriculum for this term, this time of the year. So if you have any questions, please go ahead, and if you want some revision topics, etc., also we are ready to provide anytime suitable for you. Okay, please, your turn. Any questions, any comments, any suggestions you want to put forward? Manvi?
Yes, sir.
Any questions you want or something, some queries or some suggestions from your side? Because I heard that is your sessional exam is starting from Monday or Tuesday. Is it so?
No, sir.
When? When the 18th? When it is starting?